A very well welcome to all our viewers. This again is your online fertility awareness program. You and your fertility, still proudly brought to you by the Love Foundation. I am still Dr. Young. We are at episode 18. Today we have another very interesting topic for you. I'll be talking about male infertility. Yes, male infertility. And we have defined at the beginning of this our series that infertility is the inability of a couple to achieve pregnancy after 1 year of unprotected regular intercourse. But we also said sometimes it can be from the man, sometimes it can be from the woman, sometimes it can be from both parties. But the truth is that a lot of people still think infertility is a woman's thing. If children are not coming forth, if pregnancy is not happening, most likely it's the woman's problem. So how can a man be affected, or how can the issue be from a man? That is what we'll be talking about today. That is what male infertility is. So male infertility is any factor that will reduce the chances of the female partner from getting pregnant. It doesn't mean the woman is infertile, sometimes she might be, but if anything in the man prevents the woman from achieving pregnancy, that factor is a male factor infertility. And there are various causes of male factor infertility. Now, when we are talking about male factor infertility, we are looking at the possibility of the problem coming from the level of production or delivery. Like I said, we are looking at the problem coming from the level of production or delivery. So what we need from the man is semen. If the semen is not being produced properly, of course we will not have adequate quantity, it will not be able to achieve pregnancy. If it is being produced properly but it is not getting to where it's supposed to get to, that's the problem with delivery, then we still also have a challenge. So what does this mean? This means that male factor infertility is not quick ejaculation. Quick ejaculation is not necessarily a cause of infertility in the man. Watery semen is also not necessarily a cause of infertility in the man. If the semen produced is a bit watery but the count is proper, it's adequate, it's complete, and the cells, their morphology, the motility are all intact, that is not a cause for infertility. It is also not erectile dysfunction. Erectile dysfunction is the inability of a man to maintain erection all through the course of intercourse. If somewhere along the line there's ejaculation, or the man loses erection and then gains it back enough for ejaculation to occur, you find out that that erectile dysfunction will not be enough to cause infertility or prevent the woman from getting pregnant. Then some people complain that the quantity of the semen produced is small. Whether the quantity is 1 ml or whether it is 5 ml, what is important is the number of cells it contains, how healthy the cells it contains are, whether they are motor, whether they are alive, whether there is infection. Those are the factors that are important when we are looking at this quality of semen that a man is producing. So the quantity might not necessarily be a cause of male infertility. So we have said that the problems can be as a result of production or delivery. What can cause problems in production? We can have issues like varicocele, where the blood vessels surrounding the testes have issues, and then maybe they keep the testes too warm. Maybe they are swollen, accumulating more blood, making blood flow there increased unnecessarily, making the testes warmer than it should be, thereby affecting production. That is what we call varicocele. We could also have hydrocele and things like that. Those are structural things that can prevent the sperm from being produced properly. We also have something that is called retrograde ejaculation, where instead of the semen coming out through the urethra, it goes into the bladder. That can affect how it is supposed to be delivered. So, meaning that the semen produced does not get to where it's supposed to get to. That is with respect to production. Then there are some hormonal issues too that can affect production in the man. If the man has what we call hormonal imbalance, yes, men can have hormonal imbalance. It can affect production of sperm cell. Then lifestyle. Then when it comes to delivery, the problems that can be is when there is a blockage on any path, any place along the line or the pathway from the point of production to the point of delivery, that is from the testis out through the urethra. If there is any blockage along that line, that will be what will affect delivery of the sperm cells, and this can arise due to maybe infections. Yes, long-standing infection can cause stricture and blockages along the path of delivery, that is from the testis. That is talking about the vast difference now, we're not looking at the structure, but from the path from the testis to the urethra, that path, if there's a blockage there, which can be caused by infection, this can affect or cause infertility. If there is an accident that affects the reproductive system, it can affect delivery of the sperm cells, and also maybe due to a birth defect, maybe a genetic abnormality in the development of the child as the child is growing, that can also cause a problem in delivery of the sperm cell. So how do we know when somebody has male infertility? The best thing are to run tests, seminal fluid analysis, or ultrasound scans, or hormone profile, or even a biopsy will be able to tell us if that reproductive system for the male is functioning adequately. So when you speak with a doctor, they will know exactly what tests you need, and the diagnosis will be made. And then, depending on the course, treatment can be proffered. Treatments can be from surgery to simple medication, or at the very worst, we could resort to assisted reproductive technology. So the good news is that even with male infertility, there is hope for being able to achieve pregnancy, either by treatment or by assisted. And that brings us to the end of today's episode. Hope you learned something. Remember, learn to teach others. You can follow us on all our social media platforms, on Facebook at Love Foundation or Waiting to Conceive, Instagram at Love_Foundation_, YouTube at Love_Foundation. Keep learning, keep telling others, learn to teach others. See you next week. Bye-bye.